Hello guys, today let's learn about a very commonly used instrument in our gynaec OPDs, that is the Ayre spatula. So this Ayre spatula is used for taking PAP smear. The PAP smear is used for screening of cervical cancer. So let's understand about this instrument. As you can see, this is a wooden Ayre spatula. You also get it in other forms like plastic also. So this spatula, as you can see, it has two ends. One is a broad end and other is a bifid end. You can see the bifid end over here. It has a long end and a short end. The long end is inserted into the external cervical os and the short end rotates over the cervix, that is the ectocervix, and it collects the cells from the squamocolumnar junction. So holding this broad end, we are going to take this smear by rotating it 360 degree. Remember, this is the method for taking the conventional PAP smear. The steps involved in this. So first, you are going to make the patient lie down in a dorsal lithotomy position after evacuating a bladder. Take the informed consent. Retract the posterior vaginal wall using the sim speculum. Always ensure that the patient has not done any vaginal douching or used any lubricants in the vagina, because these can obscure and give a false pap smear report. Also, we are not supposed to clean the cervix with the betadine lotion. Only use a cotton swab and clean if any discharge is there, and take the pap smear. After you have taken the smear, you are supposed to spread it on the glass slide and prepare the smear. On this, you are going to add the fixative. Fixative used is 95% ethyl alcohol, or it comes in a combination of 95% ethyl alcohol along with ether or acetone in 1:1 ratio. After you have fixed it, you can send it to the pathology lab. Remember that you should never air dry the slide. After you have sent the pap smear, now comes the time for reporting. The report of the pap smear comes as NILM, that is negative for intraepithelial lesion or malignancy, which means it's a normal report. Or it can be in the form of ASCUS, that is atypical squamous cells of unknown significance. It can be either ASCUS or ASCH, which is somewhere similar to your LCIL. It can also be LCIL, that is low-grade squamous intraepithelial lesion, or high-grade squamous intraepithelial lesion, that is HCIL, or SCC, that is squamous cell cancer, which is most common type of CA cervix. Now, after you have got the report, what is the next step to do? So as per the WHO recent update on the screening for cervical cancer, remember the age to start screening is 30 years, although ACOG tells 21 years. After you have got the report, if the pap smear is negative, you are going to repeat it every 3 yearly. If the pap smear shows ASCUS, you are going to do HPV DNA testing. If that is also negative, you are going to repeat it every 2 yearly for a general population patient and every 1 year for a HIV positive patient. If the report anytime comes positive, you are going to do a colposcopic directed biopsy. Now, after getting ASCUS, if you get HPV DNA positive, then directly you are going to do a colposcopic directed biopsy. Now, suppose the pap smear shows more than ASCUS, that is ASCH, LCIL or HCIL, you are going to directly go for a colposcopic directed biopsy. Remember that pap smear is only a screening modality, it's not a diagnostic modality. Pap smear has high specificity of around 80 to 95%, but it is only 60% sensitive. Also remember that this is the algorithm to be followed as per the WHO guidelines. Pap smear can be done in any case, but remember that when a patient is menstruating, it is better not to take the smear because the blood can obscure the film and hamper the actual reporting. So you can always advise the patient to come after her menses so that you can take a good smear. Thank you and have a great day.